Split squat, front foot elevated, barbell on back. The front foot elevated split squat with the barbell on the back is a unilateral lower body exercise that builds strength in the ankles, knees, hips, and core muscles. Split squats have been shown to increase hip, knee, and ankle mobility and decrease the chance of lower body injury, especially knees. Unrack the barbell from a squat rack or power clean the bar from the floor. Grip the bar with a firm grip, the thumbs under the bar. Pull down on the bar so the elbows are pointing towards the floor for the entire set. Place the front foot on an elevated surface between 20 to 30 centimeters high. The feet will be hip width apart. Imagine you are standing on tram tracks, not on a tightrope. In a lunge stance, place the ball of the back foot on the floor. It is critical that the heel of the back foot never touches the floor and both the knuckle of the big toe and pinky toe are pushing into the floor. The heel of the rear foot should be slightly turned out, as this will internally rotate the rear hip and help to increase the stretch on the hip flexors during the split squat. Think about tucking the pelvis under the torso. Contract the glute of the rear leg and keep it active for the entire set. The aim is to keep the torso as upright as possible in the split squat. Leaning forward in the split squat will lessen the stretch in the hip flexors, which is not what we want. The movement of the split squat is both forward and down. Think about using the front hamstring to pull yourself into the split squat. The front knee moves forward and over the toes, and the front hamstring covers as much of the calf as possible. We are trying to close the angle between the calf and the hamstring muscle without the heel of the front foot lifting off the elevated surface. Make sure the front knee does not collapse inwards as you move down and up in the split squat. Keep the knee tracking over the toes. As you move down and forward, you want the weight to move more towards the ball of the foot while keeping the heel on the elevated surface. This range of motion will be dictated by ankle and hip mobility. The aim is to keep the back leg as straight as possible while moving the knee as close to the floor as you can. How straight can you keep the rear leg will depend on the flexibility in your hips and ankles. You also want to keep the hips square. Do not allow the body to rotate. At the bottom of the split squat, you should feel a strong stretch in the front of the rear hip. Focus on pushing the rear heel away from the glute and lengthening the leg as much as possible. Use your breath to help stabilize the movement. As you move down and forward, breathe in through the nose and deeply into the belly by pushing the belly outwards to stabilize the trunk. Hold your breath at the bottom of the split squat and then slowly breathe out through the mouth as you stand up. Perform the prescribed number of reps on each leg at the specified tempo.